In particular, we worry about heat exhaustion in the summer months when it's so hot, and people need to know the symptoms of heat exhaustion. Things like heavy sweating, nausea, vomiting, fast pulse, weakness, tiredness, headache, fainting. Thirst, if you're thirsty, that's a really bad sign because thirst is one of the last body mechanisms to kick in. The problem with heat exhaustion is that if you leave it and don't deal with it, it becomes heat stroke, which is then a medical emergency. So how do you know if you have heat exhaustion versus a heat stroke? Well, the symptoms of heat stroke are much more significant. So terrible pounding headache, fainting, you're vomiting, things of that nature. And again, a heat stroke is a medical emergency, requires immediate intervention. So if you have severe symptoms, as I've described in terms of heat exhaustion, or you're having mild or moderate symptoms and you have a heart problem or high blood pressure, you need to seek medical care immediately. So how do you avoid heat exhaustion? What are the things that we do to make sure that we don't get to that point? Air conditioning is the first thing. Get into a cool environment. Fluids, water is especially good. A lot of people like to use products that have electrolytes and salt and that sort of thing added. You avoid alcoholic beverages because alcohol actually dehydrates a person. So you want to avoid alcoholic beverages. Wear light clothing. You don't want to wear wool. You want to wear cotton, white, light clothes. So between drinking the fluids and wearing the light clothes, pretty much that's the extent. And sponge baths, cool showers. That's the other thing I was trying to think of. But sponge baths is cool showers. If you're an elderly person and you can't get in and out of the tub or in and out of the shower, just a basin of cool water and just give yourself a little sponge bath. Almost similar to what you would do if you had a child with a high fever. And of course, the people that we worry about the most in this environment are the young children and the elderly, and particularly the elderly because they tend to be in environments where they have swamp coolers or fans, and many elderly have underlying health issues that make heat exhaustion turn into heat stroke fairly rapidly.